Yes.
Good evening, sir. Sir, am I audible?
Yeah, audible.
Sir, is this presentation visible, sir?
Yeah, visible.
Okay, sir. Thank you, sir.
Yeah.
Shall I start, sir?
Yeah, start now, no problem.
Okay, sir. Hello, everyone. Myself, Dr. Laxmi Prashanthi. I have been practicing in Raipur, Chhattisgarh for the last 4 years. And at present, I'm working as a JRF in Department of Homeopathy, AIMS Raipur. I welcome you all for the online repertory training course 2024. First of all, I'm very much thankful to Dr. Ghansham Kalathia sir for providing me an opportunity to share my views regarding repertory. Repertory is index of symptoms, and I would like to start the session with the throwing light on a famous quote said by Dr. J.T. Kent. That is, to learn the materia medica, one must master Hahnemann's organon, after which the symptomatology and a full repertory must be the constant reference books. If careful homeopathic prescribing is to be attained and maintained. So, once to reach the genus of medicine, we have two methods to find the simillimum. We can go through the symptom method or the system method. The symptom method follows by going through the characteristics, through the rubrics, making keynotes, provings, toxicology. Whereas the system method, which was given by Dr. Rajan Shankaran sir, defines talking about the sensation, kingdom, miasm, and the source. So we can either go through the simillimum, through the symptom method or the system method. So let's start with the symptom method. Symptom method is basically noting down all the complaints given by the patient and further finding out all the characteristics, like searching for the peculiar, queer, rare, and strange symptoms to find out what is the common symptom and the uncommon symptom. Further arranging all the symptoms in the rubric form and finding the appropriate repertory to repertorize the case. So if you have a lot of general symptoms, then you can use the BTPP, and a lot of mental or physical generals or particulars, you can go for Kent repertory, which is the best repertory. And if you have a lot of pathological generals, you can go for the Boger Boeing-Gaussian characteristics repertory. And if there are a lot of general or regional diseases or regional conditional repertories, you can go for the specific repertories like the Menton's uterus, Berridge eye, or Bell's diarrhea. But at last, for the confirmation of repertory, one must make sure that they take the help of materia medica, provings, etc. One more method through which you can prescribe on keynotes is the keynote method. And further, for more clarity or the clear picture, one can use the polarity analysis. So, to masterize or to understand the repertory, one must know the meanings of all the mind rubrics or all the rubrics in repertory. Let us discuss some rubrics of the Kent repertory. So, do you know the difference between anxiety versus fear? Like where to use the anxiety rubric and where to use the fear rubric? So if anyone can mute or chat in the box, inbox,
Yes.
they can.
Join the discussion. So we have a session like a discussion rather than dry lecturing. So when to use anxiety and when to use fear in repertory to choose rubric. Any suggestion?
uh, Anxiety is a non-specific fear. We are not having any specificity that is anxiety. Whereas fear has specific: fear of dark, fear of night, fear of ghost, fear of dog. So specifically, if we have, we can consider it to be a fear. But if we fear which is not to a specific, non-specific is can be called as anxiety.
Okay, Dr.
Okay.
Paul. Yeah, go
Okay.
ahead.
So, yes, sir. So, anxiety is basically an inner experience of an emotion, whereas the fear has an external focus. There has to be some external factor for the fear, whereas how you experience of that emotion is anxiety. For example, you may be having a fear of exam, but what you feel inward is anxious, that you feel anxious, right? So that is how you differentiate between anxiety and fear. There is one more such rubric like jealousy and envy. Jealousy is used when you have it is issue usually specific about a particular person, whereas in envy it is about some specific object, like some other person is having a car or bike, then you use the word envy. Whereas if it is regarding any person, then you use jealousy. Similarly, one more rubric like the irritability and anger. So irritability relates more of an inward experience, and anger has some external focus. One more wonderful rubric, that is the resentment. It is more qualified anger with hatred and disappointment. So when you see the hatred component, the disappointment component, and the anger component, then you should use the rubric resentment. One more rubric, that is censorious, which means being critical of others. Okay. So let us discuss some other rubrics from the Kent repertory. Mania a potu, which is a rubric given in the mind chapter of Kent repertory, refers to a condition formed due to alcohol withdrawal. The delirium condition after alcohol withdrawal. What is basically delirium? Delirium, if we cut out into short terms, it is basically derail, derailment of the things. So it is going out of track. This rubric is found in mind chapter. Many of the patients come to you speaking that they have a complaint of sleepwalking. The appropriate word for it is somnambulism, and it is found in the mind chapter. Esophagia is a term which is given in the eye chapter, which basically means that there is a turning of eye towards the innerwards. And if the eye turns towards outwards, it is exophoria. You can use this rubrics when you are repertorizing a case. One more rubric, which is onyx, which basically means that there is an abscess of the cornea. Another rubric in the eye chapter, which means pterygium, it is a triangular patch in the inner corner of the eye. Lot of times, typhoid patients complains to you that there is a black crust-like lining formed on the lips. This is called as sods. And sods are mostly seen on lips, which is present in the mouth chapter. So when a lot of patients come and talk about only the complaint itself and don't describe it more, you can look for the specific rubric in the Kent report and further prescribe it on the basis of help of materia medica. A small tumor of the gum is called as eculus, which is found in the chapter mouth. Okay. So any idea what do you mean by vents, sudamina or nolimi tangir? These three rubrics are in the Kent repertory. Anyone in the audience? The basic understanding or the meaning of vents or pseudomina.
Ma'am, whence means boil sebaceous cyst.
Okay, good, very good. Any other things that Sudamina or Nolimi Tanger? Okay. So veins are basically the sebaceous cyst. The cyst which is having punctum, and there is lot of pustular discharge from that. Mostly in Kent repertory, it is given in the name of sebaceous cyst, whereas in some places it is given under the name veins. So the chapter in which it is given in the name veins is skin veins. Okay. Many of times, lot of patients come with the complaints of appendicitis, and the word appendicitis is present in the repertory in the name typhlitis, and under the chapter abdomen inflammation typhlitis. Another word called the limpid. Limpid basically means clear, and it is given in the chapter urine limpid. Kindly unmute yourselves, mute yourselves, please. Okay. And after confinement means after childbirth. So when there is prolapse of uterus, then we use this rubric after the childbirth, genitalia female prolapses, uterus confinement after. One more rubric called as the hay asthma refers to the allergic asthma, which is given in the chapter respiration. Okay. Rubric oligoneous, which refers to greasy. When the expectoration is very greasy, then you should look for the rubric oligoneous in the chapter expectoration. One more rubric called the os calcis, which refers to the heel bone, which is found in the chapter extremities. Formication, lower limbs, ankles extend into the os calcis. Formication basically means the crawling bug-like sensation happening in the legs for once you do after once you have after long exposure of sitting. And this type of formication is mostly seen in cocaine bug poisoning in the poisoning topics. Okay. And Sudamina, which we were discussing previously, is mostly seen in people who are having profuse perspiration. There is retention of fluid in the sweat follicles, mostly seen on the back region. So the small minute blisters which is having a lot of sweat, fluid retention, then this rubric can be considered named as Sudamina. Skin eruptions, Sudamina. Sometimes there is confusion between two rubrics, that is cough sweets from and cough sweet meat aggravation. What is this sweet meat? Sweet meat basically refers to the cakes, pastry, all these bakery items, the delicacies. Whereas cough sweets from can be taken when you're having the sugar content sweets, like the Indian sweets which we have, which causes a lot of cough. So that way we can easily differentiate whether to take cough sweetmeat aggravation or to take cough sweets from. One more rubric, that is Nolimi Tanger on nose, basically means that it is a basal cell carcinoma, which is seen on nose. The carcinoma which should not be touched or it may cause metastasis. This is given in the chapter face cancer, Nolimi Tanger on nose, right? So these were some rubrics which were confusing and had a different meaning. So were discussed. Now let's see a case. This case was solved through the symptom method. This is a case of a child of 15 years suffering with recurrent cold and cough. There is nasal obstruction followed by dyspnea, and the dyspnea ameliorated by lying on abdomen. There was a lot of irritability in this child, and this child, being of 15 years, always wanted someone to be nearby, always wanted company. And when asked about the general symptoms, then the appetite was normal, but he couldn't control its hunger. He used to get a lot of gastric complaints. There was great desire for everything, but aversion to sour was specific. On examination, red tipping was visible. Other than that, white spot on nails was seen. Perspiration was offensive and mostly on the axillary region, and the stools were hard and offensive. Being dyspnea better by abdomen, the child used to prefer sleeping on abdomen. And the mind symptom which was peculiar in this child was want of company always and alone aggravation. So these were only the basic symptoms which could be collected from the patient. On repertorizing it, I used Kent repertory and I used the rubrics company desire for while alone aggravation, perspiration offensive odor, sleep position abdomen on, extremities discoloration finger white spots. So the arsenic was the first prescription, first remedy which was coming in the repertorial chart. And other than that, the state of anxiety and the state of dyspnea in which the child was, arsenic 200, 3 doses was prescribed, followed by PL. And the children did well. The child did well. Okay. So now let's go into the symptom method. Dr. Rajan Shankaran sir has classified the experience into 7 levels: the name level, fact level, emotional level, delusion level, sensation level, energy, and the blank. And he further made it more simpler for the prescribing of potency on the different levels. So let's start with the name level. The name level includes all the diagnostic features, the laboratory investigations, pathological complaints. Here, the patient comes to you with the identification of sickness, what disease he's coming with, no, and he doesn't go more beyond that. Like the case which I explained before of nolimetangere, the patient will just come and show and tell that this is a basal cell carcinoma which has to be treated. He won't talk or describe more about it. Then you can use that rubric. Or the patient may come with the black crust of lips, which I was talking previously in the typhoid fever. So you just have to look for the specific rubric if available and then prescribe on it if it is a sure, perfect, proper rubric. Okay. Next comes level 2, which is the fact level. Fact level basically classifies that you are getting more qualifying factors of the disease or the diagnosis. You get the location, you get the modalities, you get the more qualifying factors, whether it is aggravating, ameliorating, or the patient will give more facts about the pathology. For example, asthma relieved by dancing. Many of you would be knowing the medicine of this asthma relieved by dancing.
Yes, you can speak or write.
Anyone who can tell me what is the medicine for asthma relieved by dancing?
Sepia.
Okay, good.
Tell it
So
to
the sepia is a medicine. Sepia is a medicine. Asthma relieved by dancing. Okay. Next comes the level 3, the emotional level. So here the patient basically defines or associates the complaint with lot of emotions. It can be a specific emotion or it can be multiple emotions. They might be tension, they might be fear, they might be worry, anger or irritation, grief, like that. So the emotion can be based on the specific incidents or on being the specific condition of disease. The patient may feel bad or disheartened by seeing his own investigation reports. That is situational on that specific moment. Or it can be a deep pain or deep chronic emotional state which has been running throughout the life, right? So on that basis, you decide whether the emotion is a deep chronicity one or the superficial or situational one. So the ignitia is having silent grief. The rust talks about anxiety about children. Next comes the level 4, which is the delusional level. Delusion basically means a false belief. And there is an image or picture through which the patient describes himself. It is not based on facts. The image defines the patient, right? And for example, you have a rubric that delusion as if the legs are made up of stick. Tuja comes into that. So This level speaks all about, the patient would speak all about as if, as though. Next comes the level 5, which is the sensation level. It is basically the act of the vital force. You get a lot of sensation words, like a lot of verb words, acting words, like squeezing, tightening, no, compression, expansion, related to some situation, but it is main source. It is a source of vital force. This sometimes correlates with that of emotional level, and you get confused whether the patient is talking about emotional level or about the sensation level. So the emotional level is very superficial, whereas the sensation level is all about the vital force speaking on itself. It is the sensation as a whole. It is the expression of energy. And it may happen that there is one sensation which runs throughout the whole body, or there are various different sensations which run through the different parts of the body, depending upon the kingdom, which I'll be discussing further. The level 6 deals with energy. So energy is basically the actual expression of vital force. It is about the pattern of vital force, the pattern, the other song which we are seeing, the other pattern of the whole vital force. And mostly the sensation and the energy almost flows together. Vital force basically expresses its energy. Okay. So now let us discuss all the 3 kingdoms with some cases. The mineral kingdom, the plant kingdom, and the animal kingdom. Starting with mineral kingdom, Dr. Jan Scholten classified various elements through the periodic table into various rows and themes of various rows and themes of different columns. He explained the process or the journey of life, the development of life through the rows and columns. So basically what happens in minerals is, electrons are there. They need to form a complete octet. So to forming of a complete octet, that one electron should either go outside or should be removed off, or one electron is to be shared. So this stability, and what is the issue, or what is the importance of this sharing of electrons, or the removal of electrons, or the adding on electrons? That is to form a complete octet, that is to become stable, to form a complete structure. So this mineral kingdom always talks about structure, about stability, about sharing of electrons, or to make each other complete. It is always that whether I am lacking one electron, if we take on the person basis, whether I am lacking something or whether I am losing something. So how I maintain myself to make my own condition stable. So the talk is always about structure, to develop the structure, to maintain the structure, to support my own position, for the security, for the power, and there is feeling of complete or incompleteness. So there is always a question that whether am I complete to myself or am I not? So I may need someone who would complete me. The talks would be like, if you are there, I'll be complete. You complete me. So there is need of someone to complete themselves, to maintain their own structure. So the whole story revolves around building, maintaining, and the falling of structure. The issue of stability, to share is to exist. The sharing of electrons is to exist. How you maintain, how you are containing that pressure, capacity, resistance is important, with the fear of lacking or the fear of losing. Okay. So the main problem or focus of mineral kingdom patients is that it is within himself. Whether am I completely developed or am I not completely developed? Whether I'm lacking something in myself, or is it that I'm losing something? I had a structure and now I'm losing. I had a position and now I'm losing. So the talk completely resolves or rotates near the structure itself and to being stable. So, as I said previously, Dr. Shalty has classified every row. And the main themes of row, basically, as it is going from the journey of life, starts with conception to coming into life. Then the row 3 is fetal life and birth process, which basically defines the growth of a baby, the womb stage of a baby. And further, the identity or the nourishment of the baby, how the baby is taken care of, loved, how it is nourished with love, etc. Further, when the baby develops, he has to come out into the world, face the challenges, make himself secure, find a job. So the row 4 talks about security and task. Whereas row 5 is when there is a lot of opportunity, how you create, how you are outstanding than others, how you are more creative, how you are more performing is important. So that is focused on row 5. So row 5 patients talk usually about creativity and performance, that my performance is getting low. I am not able to perform the way I used to do previously. And further, after this comes the important factor of responsibility. Row 6 deals with responsibility. And row 7 is the last phase or the old phase, the old life, where you have stopped into holding things. Everything is letting go, leaving off, disintegration, the last stages of life. Okay. Along with rows, Shalton also has classified the columns. So the center column, the column 10 is the place where the structure is completely developed. And towards the one side, we have the developing phase. And to the other side, it is the downfall of the structure. Okay. So how from left you are growing and then how you are downfalling. The whole phase is described through columns. How you begin the structure, where the structure is not at all formed. It is completely dependent. And from completely dependent, you go to a phase where you want some support. When you get some support, you can walk. It's like the second one or the third one. The second one phase is like, you are driving a bicycle and you need assurance that, okay, your family member, anyone is holding the bicycle and you can drive. So only when there is a threat, you need some support. Gradually, this happens that, you come into a lot of stress. You have to maintain the confidence. You need support in some tough conditions. And you need to have resist for a lot of high pressures, toughness, endurance, till that you reach the column 10, which is the complete structure, the successful stage. And now what happens that after 10th stage, you have to reach the other side, which is the downfall. So the downfall actually happens by the phase that you have to maintain the structure. There is a lot of restlessness that people are attacking your structure and you have to be controlling yourself from falling. There is fear of failure. There is the situation where the structure is just about to erode. There is falling apart. And suddenly you come into a phase of column 17 where the structure has gone down. It has been a complete burden, trapped, confined by structure. And followed by column 18 where nothing is left. There is complete collapse. Totally isolated, detached feeling. Feeling as if everything is done. Now I am self-sufficient. Complete within. The whole octet also is completed over here. For example, the arsenic which we study has lot of fears, lot of anxiety in it. Arsenic belongs to column 15 and row 5. It is that phase where, the building is just about to fall. That one brick which you will remove, the building will fall. So, how that anxious state is that if this minute thing is going to fall, the anxiety, the restlessness would be too much. That's why we see a lot of anxiety, a lot of fear, anxiety about the family, that he's going to die, that it is the last phase of life, and a lot of restlessness. Thus, you can correlate with this and you can study the arsenic. Okay. So now let's take one case. This is a case of a female of age 35 years suffering with migraine and gastric complaints since 2 years. Okay. And she was taking Saridon completely, like she used to take a lot of Saridon, which when the complaint increases a lot, she used to take it very frequently. And her headache was better by vomiting. She could not bear any noise and light. Whenever there was headache, she used to feel very weak, very lethargic during the pain. And the peculiar thing about this case was she has 2 children and she always wanted them to be there nearby. Always wanted to be with the children, to teach them, to enjoy with them, to play with them, to be very happy and jolly type of person. She was very, when she was talking to me in the case, she was very much happy. She was the jolly nature of, being very friendly and very comfortable. That was very much peculiar of her. And this type of jolly nature, in spite of headache, she used to prefer having good time with the children. Okay, she used to make sure that she's spending her time with children. She always wanted company, even in headache also, though there was that she couldn't bear noise, but she always wanted company nearby. And she never stayed alone. She always, she used to say that after when she's alone, the complaints used to aggravate a lot. This complaint basically actually started, when her husband stopped spending time with her. She used to completely get disappointed. Why is the husband not spending time with her? And why is he not giving time to her? Why is he not being with her? So she used to feel as if she is not being loved or cared. There was some incomplete feeling inside her. She used to feel that husband doesn't support her and is not loving her. She's very sad and disappointed. Okay, she always wanted pampering, always wanted someone to talk to her, to take care of her, to love her always. And I tried to ask her general symptoms, but I couldn't get much of the general symptoms. So further, because I got a lot of mind symptoms, I thought of going to the childhood history. So the childhood history was basically that she was a very happy, jolly kid. Her parents used to care for her a lot. She was the most lovely, that sweet baby of the whole house, the most lovely baby, and always was concerned about others. She used to take care of each and everyone. She used to make sure that, she's very good to everyone and very kind to everyone, because she just used to love it. There was no other intention. She used to love it. And always used to prefer that she communicates a lot. Okay. So this was just the case. Now here what actually happens is, you got a symptom of headache better by vomiting, cannot bear noise and light. So you should understand what is the common symptom and what is an uncommon symptom. In migraine, headache better by vomiting, cannot bear noise and cannot bear light is a common symptom. So if we are focusing only on those rubrics and only on those symptoms and converting into rubrics, we will reach nowhere. You have to find the peculiar symptoms, like from where the complaint started, how it started, how is her mental history, how she's doing, if we are having any other observations, or all this, like how she behaves when she's having headache is important. Okay. So any idea of the medicine, anyone could guess the medicine, or let me know what medicine would have been given.
Hello, pulsatilla.
Okay.
Okay.
A nice attempt.
Nitromil.
Natrum. Okay. Anyone else? Natromir. Okay. Anyone else?
Pulsatilla.
Oh, okay. Good. Pulsatilla. Anyone else?
Caviars.
Caviars. Okay. Good. Anyone who would like to give an attempt? Okay. So she was talking all about, caring, nourishment, love, and care. And she always wanted support. So here we'll take the kingdom knowledge as well as the rubric knowledge together cumulatively will prescribe. So the core here was she was very much communicative, very friendly, always wanted people nearby her. So the rubric, which, like making her charm nearby. So the magnetized desire to be. And a very important rubric that she wanted company. In spite of having an headache, she wanted company desire for. The complaints started from disappointment because the husband couldn't give her time. And the other rubric was affectionate. She was too much affectionate and returns affection. Okay. And this medicine, which I'm discussing now, which I'm going to discuss, has the core rubric, or not the core rubric, but the core sensation of delusion, unloved and uncared. This is written in Soul of Remedies by Dr. Rajan Shankaran sir. Okay. So the medicine which was prescribed was phosphorus 30 because it belongs to the row 3, all about nourishment, care, love, and she's not getting what she wanted. She was craving for it, but she didn't get. And about all the communicative part and the magnetized part. Okay. But what basically happened that after prescribing phosphorus 30, the pain still persisted. It only reduced till 30%. So what I did, let us take a follow-up. So I asked her state, how is her state during the headache? What actually happens when she's having the headache? So she complained of being very much weak, very much lethargic, completely drained type of situation in the headache. But still, she used to do so much for the loved ones. So to get back the love. So to feel loved and cared was her theme. Still, there was a lot of aggression that her husband couldn't give her time. With the theme of being completely drained, exhausted, debility, and the theme of being not getting loved, illusion, unloved and uncared, the themes of phosphorus existed along with the acidic themes. So then she was prescribed phosphoric acid 30. And after 2 doses, she did completely well. The headache completely reduced within a month. Okay. So let us discuss some of the acid remedies and the basic theme of acids. There are 2 types of acids, the inorganic acids and the organic acids. Organic acids are the weak acids. You have lactic acid, acetic acid, formica rufa, carboxylic acid, etc. Whereas in the strong acids, you have sulfuric acid, hydrochloric acid, nitric acid, and the phosphoric acid, and many more. So the basic acids are those compounds which break into hydrogen and the other compound when added into aqueous solutions. So when there is the breakage of this hydraulic compounds or the bonds, there is a release of lot of heat from it. And thus comes the lot of heat content in acid themes. Lot of decaying, lot of destruction. That heat is lot of burnt feeling. And there is lot of over abuse or abuse of various organs in acid. So whenever it is a theme of acid, you will see conditions of being overused. Phosphoric acid or this acetic acid, fluoric acid, lot of weak, paler themes. Too much of lethargy, too much of drained out feeling. There is severe overactivity. There are 2 poles, you will have severe overactivity, continuous overactivity, continuous overactivity to a state where there is complete exhaustion, drained out feeling that makes you go through lethargy. Okay, so this overactivity, hurriedness on the one pole, and the other pole you have exhaustion, prostration, aggressiveness. And these acids whenever they are thrown somewhere, there is a lot of corrosion. There is corroding theme, destruction, okay, decaying. With the themes of overdoing, we have the malnourishment, weakened growth, and lethargic. Phase failure is very weak, as we have seen in acetic acid, etc. And acids are mostly chilly, with the burnt out feeling, with the feeling of being apathetic and indifferent because they have done too much. So there is a story or there is a theme of being too much doing, then getting exhausted to a phase that they come into apathetic or indifferent feeling. Okay. So now let's talk about the beautiful kingdom, the animal kingdom. So animal kingdom basically means how it is the issue of survival. How you are trying to maintain yourself to survive. You know, there's a lot of me versus you issue. Many of you would be knowing this, me versus you issue. You have to maintain yourself to move, to live or to die, to kill or to be get killed. There is me versus you, the prey and predator issue. So the me versus you in this, the you is the other person as a whole affects him. Lot of competition, lot of sexuality, lot of aggression, lot of attractiveness, vividity, liveliness. You will see lot of sensations, lot of beautiful stories coming out when you take the animal kingdom case very detailedly. All talks about attack and defense. You know, who wins, who is good in the race, who comes first, who affects, who survives. When the patient talks, you will get a lot of theme of jealousy, competition in them. And there is always that the other one is doing good, so I have to do more good than him so that I come the first in the race. Okay. And the animals are further classified into vertebrates and invertebrates. So let us discuss the features of invertebrates. Invertebrates are those in which the nervous system is not so developed. There is spinal cord problems. They are so sensitive, so primitive to the development that the external stimuli, any soft thing or anything, produces an issue or causes a trouble. Even the molluscans, a small dirt itself goes inside and causes irritation and a beautiful pearl is formed. Right? They are very minutely sensitive. They are not much differentiated. They are very well, not much differentiated, not so defined. They have a feeling of smallness, weakness, timidness, with the features of suddenness. Like as if they're having a very short lifespan and the life may end at any time soon. So everything has to be done in a hurry. I have to do this thing, I have to do that thing, n number of things, lot of restlessness in them. The issues of life and death, self-centered personality. Okay, so we have molluscans, we have insectas, we have spiders. Molluscans are one in which there is a soft shell body inside and a hard, soft body inside and a hard shell outside. These by a hard shell. And how environment is protected, how a small dirt goes inside and causes a trouble is a mollusk theme. Then comes the insecta, lot of restlessness, and by there is a lot of attraction and defense, camouflage, and how to trick. That was spider. So let's discuss case. This was a case of postpartum hemorrhage. Trouble started after her marriage. You know, thing with in the previous case that no one cared for me. She was a well graduated, qualified woman. Okay, and then she just faces emotional of experience. So I expected would take me, but he didn't even care, and I was I had to choose between my family here. I was having a lot of restrictions. It's so suffocating. I felt as if it. I was confused whether to join my
Why?
studies, cut my family. What I do? At the end, family is more important. So I sacrificed myself, everything for the family. My family is doing all for me. Family is more than studies, more than profession, she told. Yeah. So once conceived, once she was conceived, after conceiving, the in-laws didn't take care of her. Hello,
Yes.
am I on?
Yes. Your sound is cracking.
For the last 5 minutes, your sound is not clear. It is breaking. Maybe internet connectivity, video may be put off, and sound may be allowed.
Yes. Internet problem.
Ma'am, for that you have to leave and rejoin.
Yes, Prashanthi, go offline and come again online. Okay. So till she come online, let's have a
Hello, sir. Am I audible?
yes. Now you're audible. Just go ahead. Share screen and go ahead.
Yes, yes. Yes. So is the screen visible, sir, now?
Yeah, visible. Go ahead.
Okay, thank you. So she was, too much concerned that the husband is not taking care of her. She thought of living in her parents' house itself, because she didn't even go to her in-laws after delivery, because no one used to care for her a lot there. She used to feel very jealous that, how other husbands are taking care of their wives. No one takes care of me. She feels as if there is something left in her, there is something incomplete in her. A very strange feeling. As if, there is something space in the heart. She was talking a lot of things, n number of things, multiple things when not talking the case. She said that I'm always alone. I expected a lot from this marriage. This was everything from me. but it just broke me. I was disheartened. I hate my husband. I just don't like that human, but I have to go to him because he's my support. My husband is my support system. And I just expected love and care from him. I don't get any support, no love, no understanding. So she was like, maybe I think that I'm not at all attractive, or I'm very ugly, because of which my husband doesn't love me. So it's better that, death is more better than this, man. And, I'm trying to show that I'm very much strong, but the way he does, it hurts me a lot. How much can I handle this? When I asked her more detail about, what she feels, so she's like, marriage is husband and wife. There should be togetherness, sharing, caring. Should be, one should console each other, becomes protection of one another. Companionship is important. But here, I don't have anything. I feel as if something is restricting me. I am not able to live fully. It is like as if I'm tied. I want to expand. But I feel as if something is pulling me down. Something is, pulling me very much down. There is so much of heaviness in my body. Some suction type of feeling. Too much of heaviness. Feeling as if I'm shrinking inside, becoming so small. I want to expand, but something is stopping me. Something is pulling me behind. Okay? Then, when I asked, how it is being on the opposite side, when you are trying to talk about sensation, if you try to talk about the opposite side, because if you're putting the patient in much of struggle of that phase of being tight, compression and all, you'll reach nowhere. So when you put on the opposite side, like how is it on the opposite side, then you will go to the expansion. She said that I feel so light, as if I'm flying in the world. There is nothingness, no suffocation, no constriction. I'm very happy. I'm floating. I feel as if I'm loved. People are understanding me. I'm very much cheerful. And the dreams of frightening, screaming, and terror. And, as I asked everything to cover the whole case, so she was like, I love vinegar taste and sweets. There is aversion to fats, and her favorite hobby is dancing to light music. So whenever she dances little bit to very light music, she feels better after it. Okay. So, any guess what would be the remedy? Because she spoke a lot about different sensations. Anyone could guess the remedy?
Beauty Mujhe or eagle?
Can you just repeat it? I couldn't get you. Falcopy, okay. A good attempt.
Falcon or eagle?
Anyone else?
Tarantula?
Sepia?
Spongy, madam.
Anyone else? Tarantula. Okay, a great attempt. Anyone else?
Spongia, madam. Spongia.
Spongia. Okay, nice. Okay. Any other guess?
Sepia?
Sepia. Okay, good. Okay. So, as one of the doctor has attempted it, right? It was, she was given sepia, 1M. Because there was lot of talk about the delusional level and lot of sensations which were coming when you pushed her. So why sepia? Because, there was a feeling of dependence. And she felt as if her body is disfigured. She is very unattractive for the opposite sex. And what did she do? In order to keep them happy, she sacrificed herself. The theme of, to get accepted by others, you are doing something which you don't want. You're sacrificing yourself. And what did she do at the end? She withdrew. She didn't go to her in-laws' place. She became averse to her husband and children. Doing too much and not getting anything in return, and further made her indifferent. And the rubrics which I used here was delusion poor he is, cares full of domestic affairs about, dancing emulation, as she said that she loves dancing in that silent music, and the very beautiful rubric has having only two medicines, that is mind undertaking things opposed to his intentions. She is doing something or undertaking things which she doesn't want, opposed to the intentions. This rubric is having phosphorus and sepia only. And then mind delusion, he or she is neglected, and further indifference family to his. So why is sepia here? Because there is a feature of being not attractive, something being pulled down. One core rubric of sepia is delusion, as if something is pulling backwards, as if he's going to the back. Okay, that is a core rubric of sepia. And the smallness, the minuteness, as if I'm nothing. I have done so much. I have exhausted myself of doing so much to the family. I have sacrificed so much, but what am I getting? They don't even love me. They don't even care for me. And being so sensitive. That's why sepia panem was prescribed to her. Okay, and she did completely well. Now let's come to the plant kingdom. So plant kingdom is all about sensitivity and reactivity.
Your PPT is not moving down.
So, yes, sir, just a minute.
So if possible, close video. Close your video.
Okay, sir.
Yeah, because video take little more
Okay, sir.
internet. Yeah, go ahead.
So plant kingdom deals with too much of sensitivity and reactivity. The plant kingdom theme is all about being very sensitive. Every slightest things or every small minute things affect them. Lot of external circumstances, the external environment, the external nature, everything affects them. And they have to adjust according to the environment. They are very much emotional. A slight change in the climate, a slight change in any, parameter affects them. So here, as there is an issue with me versus you in animal kingdom, here also the you factor is the other human, but the other human's words and actions affect them. The words or the behavior or the nature of human beings affect them. As a whole, the person doesn't affect. Okay, and how do they adapt to the situation is important. Like the sunflower, a basic example. The sunflower rotates according to the sun. So how it is adapting to the climate, how it is easily affected by the surroundings, how this things, is affecting, and how the patient is reacting to it is important. And as described in the animal kingdom, there were different sensations through the whole body in animal kingdom. Whereas in plant, there's the same sensation which run throughout the generals. Okay? So plant actually react to a stimulus or a situation with a sensation and adapt accordingly. And this whole sensation runs throughout the whole generals. And how they cope and adapt in a specific situation leads us to the miasm. So that miasm concept is a very different concept. And the sensation and the function, how is the patient reacting to that sensation is the function, and the function further leads to the reaction. How is the person, whether it is an active reaction or a passive reaction. So if it is an active reaction, for example, to the feeling of being insulted, whether you are reacting in the same way, insulting in the same way, that is the active reaction or the aggressive side. And to the other side is you're becoming too much numb. Too much you're feeling, too much, not at all reacting the same way, to become the docile side, the passive reaction. Okay, so you see both the reactions. You either see the active or you either see the passive in a case. So the whole core of plant kingdom revolves around something outside of him affects or excites within. Okay. So let's discuss one more case. This is a case of a boy of 20 years suffering with anxiety and tremors and palpitations. Okay. The complaint started when he joined his graduation. He was so much anxious on the joining time itself that, every slightest thing he used to get lot of anger, but never showed that anger outside. There were a lot of aggression, but never showed it because it was not a destructive anger, but a fearful that someone would make a fun of him. He would be humiliated. Okay. And he became very pale when during these attacks of anxiety. A slightest thing or a slightest behavior used to affect him. His complaints used to start increasing when there was severe crowd, too much of crowd. Every minute thing used to disturb him. Right? How it used to disturb, when I was taking the case, this patient, I was just normally removing the pen. With that pen itself, he told me that, ma'am, please don't move it because it is somewhere that irritating me. That small thing also was irritating him and disturbing him. There was a lot of irritability inside, but it was due to some slightest things, a very trivial things, a smile, minute trivial things. Yet, what he did, how he used to react is, he never used to say or fight. As it may hurt others and people would laugh and make fun of him. But what he used to do, he used to rather keep it quiet, accept everything within. And being a very sensitive person, very sensitive. And if asked about the other, his history or, the way he behaves with everyone, this kid was very much, creative. Always wanted to learn new things. Very intellectual, very mild and kind also. Okay. So this was the only thing which I got while I was taking the case. So any guess what would be the remedy? Only with this much of information of anxiety, palpitations and tremors and very small minute thing affecting. Or if anyone can guess the kingdom also, it would be great.
Plant kingdom, ignitia.
Plant kingdom, ignitia. Okay, very nice. Anyone else?
Telenculasi, Staphylococcus aureus.
Great. Okay.
Staphylococcus
Okay. Nice. Anyone else?
Gelsemium.
Aconite. Okay. Okay.
Staphylococcus.
Okay, great. So almost many of you all have come towards a nearby family, the near family. So the remedy was given Pulsatilla 1M. Pulsatilla belongs to psychotic miasm in which the patient hides everything inside, suppresses everything inside. Why Pulsatilla? Because it belongs to the Taranculasi family, which has the ailments from humiliation, indignation, of being hurt. A lot of secret anger with grief and rage. Themes of being abused, insulted, lot of irritability, offended, and being the very primitive state of development. There is themes of raw nerves penetrating, electric shock, insulted and offended feeling, excited easily, morbidly sensitive, with the themes of anger and guilt. Anger and guilt runs throughout the family. But how does he react to it? He keeps himself numb. He keeps himself hiding, silent. Okay? And the active reaction is nervous tension, inward conflicts, sensitive to trifles, very much passionate, brooding, tremors from emotions. The complaint which he basically came from, the tremors from emotions. And the passive reaction is numbness and blunting, okay, to become numb. So the pulsatilla is, how is he experiencing it? That is the ailments from hurt or humiliation. That is the experience. And how is he functioning? That is being numb or blunt. So the pulsatilla belongs to the Ranunculaceae family and is psychotic mechanism. So it is like that they keep inside them, whatever the situation be. The coping mechanism is by hiding everything inside and being numb. Okay, as I said previously, they belong to a very primitive area of development. The senses are very raw. They have raw nerves. They get easily offended. And according to the PEM method, the personal evolution method, this pulsatilla belongs to the first subclass of Mangalide and orders Ranunculates. This group Ranunculaceae, actually the whole plant chart and animal chart is defined into different ages of development in personal evolution method or the psychiatric method. Okay, so the Ranunculaceae family belongs or is covering the 3 stages, that is the early childhood, school age, and the adulthood, where there is themes of raw nerves penetrating and then wanting to do new things, undertaking creativity of the themes of the development. And Ranunculaceae families are the ones who cannot make boundaries between themselves and others. So they are very much aware that they are very much different from others. Though they are something different, something within themselves. Lot of nervousness, excitability, and irritability. And being very primitive, there is strong tendency, because the skin itself is so thin layer, like if we describe it, the skin is so thin that everything penetrates inside. So there is somatization of emotions. All the emotions penetrate very deeply and they can't handle this. So the emotions straight away produce the symptoms. They are very lively, they love to be open in nature, but they react very acutely, being very primitive. The problem touches the organs. The tendency to withdraw, weak-willed, and everything is new and raw. Themes of being abused, harassed, with the themes of anxiety. And here the other rubrics which was taken in the case was mind anxiety, pale faced with. Mind anxiety crowd in and fear crowd in. So this is how you can easily differentiate whether the patient is, the cases was being primitive, wanting love and care. But how the kingdom importance, how it is the importance of kingdom to know the themes of kingdom through which we can reach the simillimum. So you have to know both the symptom and the system method to easily repertorize and reach the exact simillimum. So you have to take the help of repertory, the symptom method, the system method to understand the symptom. So this way, working with both system and the symptom method helps to confirm remedy and reach the exact simillimum. Thank you. Anyone who is having any doubt or any issues?
Ma'am, can we have the plant kingdom PPT once again?
Okay, just a minute. The basic, the theme, this one?
Yes, yes.
Yeah, okay.
Next also.
The YouTube lecture will be provided. Yeah.
Yeah.
Anyone who is having any doubt? Yes, sir.
So anyone have any question? You can ask or write down for today's session. Today's session wonderfully explained how kingdoms are important. Uh, when you have to merge the idea of kingdom and kingdom themes with repertory. So if anyone have any question, you can ask. Okay.
Thank you, ma'am. That is nice session today. It was very nice, very informative. Thank you so much.
Yeah. So when there is no question, then there is two possibilities. Either you understand everything or you do not understand anything. So we believe you understand everything. Let's conclude here.
She has explained
Thank you. Thank
everything
you so much, sir.
here, so it is very much understandable.